Vaginal prolapse is when the vaginal walls descend and it bulges into the vagina and could actually come out of the vaginal opening. And the cause of it generally is giving vaginal birth, especially in women who have either many babies or very large babies. Usually anything over 8 pounds tends to really stretch the vaginal tissues. And every time a baby is born, the vaginal tissues never revert back to their normal state. There's always a little bit of relaxation each time. And because the pelvic floor is at the bottom of the abdominal cavity, gravity just pushes everything down that way. When people cough, they sneeze, or they have any respiratory illnesses, all of the pressure goes right to the pelvic floor, and that's where the vaginal walls are, and the uterus as well. The uterus tends to prolapse because all of the ligaments get stretched during pregnancy. There really isn't anything that one could do to prevent this from happening, because vaginal birth is a natural process, and unless there's a way to assure that you're going to have a small baby, which isn't possible, babies are just going to do what they do when they come through the vaginal canal, and that's to stretch the tissues out in that area. The symptoms of vaginal prolapse is generally pressure down in the vaginal area, and also the sensation that something is coming out through the vagina. And in many cases, in the more advanced cases, there is something coming out. The uterus could be coming out through the vaginal opening, the bladder could be coming out, the rectal wall could be protruding, or there could be what's called an intercourse, which is the pelvic floor, which is actually protruding through the vagina. And when it starts protruding out of the vagina, it rubs on the clothes and can develop ulcerations in the tissue, which is not a good thing. The treatment for vaginal prolapse mainly is surgical, although in some people we use what's called a pessary, and it's a ring or a donut-shaped apparatus that we put in the vagina, and what it does, it just holds the tissues that have prolapsed up. And we use that mainly in women who are not good surgical candidates. That surgery would be risky for them, so we use that method. We do offer it to others. However, when the foreign body is in the vagina and holding up the bladder, it tends to create either pressure or an annoying vaginal discharge. And so in women who are surgical candidates, the treatment usually is surgical. And because the uterus is prolapsed, we don't elevate the uterus. We typically would remove the uterus, especially if it's prolapsed. In some circumstances, we would leave the uterus if it's not prolapsed and just repair the bladder walls. And we would sew the bladder walls back up into their normal positions. If they're leaking urine, we'll put at times a sling, which is made of a small mesh, to hold the bladder neck up so that when they cough and sneeze, they don't leak urine. And then on the rectal side, women, if they have a large rectocele, which is the rectal wall prolapse, they have difficulties with bowel movements. So we sew that tissue all the way back up into its normal position, so their bowel function becomes normal again. And then the muscles that were separated coming through the pelvic floor, which is the opening of the vagina, those muscles get very separated at times, and so we put those muscles back together. So when we're done and they heal, which takes anywhere from 6 to 8 weeks, the vaginal canal is essentially like they had never had a baby. The reason in certain circumstances it is recommended to repair the vaginal tissues is, especially one, is if they're symptomatic, and two, if the tissue is already protruding out of the vaginal opening. And in that situation, the tissue that's prolapsed is rubbing against the clothes, and it could become ulcerated, which could result in infection. So when it gets to that point, I generally recommend that they get treatment either with a pessary or surgically. And if they don't, then those things will happen. One of those non-surgical methods to try to control genital prolapse is what's called Kegel exercises. And those are the exercises where a woman would squeeze the muscles of the pelvic floor, and they would do those exercises regularly throughout the day. And what it does is it strengthens the muscle and it increases the tone, and therefore it holds things up a little bit. So it may prevent further prolapse or at least slow it down, and in some cases may actually help with the leakage of urine.